Okay, practical for Enterobacteriaceae and Pseudomonas. Enterobacteriaceae, you know, they are gram-negative rods. They are facultative anaerobes, are oxidase negative. All species ferment sugar glucose, but there are some different, but they ferment sugar, glucose mainly, and reduce nitrites to nitrates, nitrates to nitrites. So these are the main characteristics. Oxidase negative, they ferment sugar, mainly glucose, but also possible lactose fermenters are there, and reduce nitrates to nitrites. Here about a case. A 66-year-old lady presented with suprapubic pain, frequency, dysuria and urgency for 3 days. So suprapubic pain, frequency, dysuria. So when you are reading this case, what are the which system it's related to? That is genitourinary system. So patient may having suprapubic pain. So it more towards bladder-like and frequency having going to pass several times urine, dysuria, pain during micturition and urgency, always feel, want to defecate, maybe feel likewise for 3 days duration. She has swimming fever as well, so indicates an infection of. So when you are reading the case history in this level, we often give the diagnosis and ask the management and investigations because you are in third year. On examination, it's ill looking. Past medical history important is diabetes. And UTI was suspected and urine culture was done. So at the same time, since patient is admitted, we do blood culture because patient presented fever. What is the sample? We can collect from 60-year-old lady, not ill looking, but not totally deteriorated. So we can catch midstream clean catch urine. We can take. What is the container? It should be sterile because we are putting for the urine culture. It should be scoop capped, leak proof, white mouth, labeling. We have to put the date ticket number and also bit of history and any antibiotic use. Luckily, this lady hasn't used any antibiotics. She straight away, while tolerating that house, came to our unit. So sample was sent to the lab without delay. You have to think, if it is delays anticipated, we can keep up to 24 hours of urine on room air. If not, we can add boric acid as a preservative. Okay. So next day, so now we got the urine sample. We are using this calibrated vial. This contains 5 microliter. So once we dip and get this bubble fill and put in on Macoun cake or clay tail. Here we are putting Macoun and blood. In a microbiology lab, we may put in clay. We can do screen this way. Primary inoculation, strict right angles likewise. Then we keep this inoculated Macoun cake plate in incubator, 37 centigrades overnight on room air. Next day, we got a growth. This is our growth. It indicates pink color, that is lactose fermentin colony. For your knowledge, I put if this is pink, this is just yellow color. Yellow color, it is non-lactose fermentin. So this media, Macoun media, is a selective differential media. So it grows more often these urine pathogens, as well as it could differentiate into lactose fermenter versus non-lactose fermenter. Lactose fermenter appear in this manner. So then non-lactose fermenter, there could be non-lactose fermenters as well, like Protease in the Enterobacteriaceae group, Salmonella shigella, likewise. This could be coliform E. coli or Klebsiella pneumoniae. Those are lactose fermenters, strong lactose fermenters. We do gram stain, we show gram negative bacilli. Okay, gram negative bacilli. So next, same time we do oxidase test. But perhaps if Pseudomonas really causes urinary tract infection, it is a non-lactose fermenter. Anyway, we do oxidase test. It's used to identify bacteria that produce cytochrome C oxidase, an enzyme of the bacterial electron transport system. Non-lactose fermented organisms, we often do oxidase tests. Now, lactose fermenters, perhaps no need to do oxidase test. We know it is Enterobacteriaceae. Positive oxidase test, Burkholderia pseudomallei and Pseudomonas. Usually, I said Enterobacteriaceae are negative, oxidase negative. Okay. Here, we don't want to do, but we can do for in lactose fermenter as well. So, how to perform oxidase test? Take a filter paper soaked with the substrate tetramethyl phenyl adenamyl dihydrochloride. We'll say TMPD. You don't want to know this long name. Moisture paper with sterile distilled water. Moisture paper with sterile distilled water. Then pick the colony from using a wire loop to be tested with wooden or platinum loop and smear in the filter paper. Observe inequality area of paper for color within 10 to 30 seconds. That's what we want. So once we have taken using loop organisms from this plate, this area or this area, even this, we are putting here. So if color appears pink color, we'll say purple color appears within 10 to 30 seconds, we take as oxidase positive, while no color there, term oxidase negative. Meanwhile, apart from oxidase testing, now we want to know further identification. So we take this culture plate and take using this straight wire, you can see we are putting into KI, Kliegler iron mega media. It's a difference again selective differential media. We can subculturing straight away, we are putting this wire loop here and taking out and streaking here likewise. So we are putting this is area called slant because it exposed to the oxygen. Here it is totally closed, no air is there, it's but. So we are putting straight away wire loop. Once we are taken using this wire loop, we take using wire loop like it's almost just a pen light. Then we take using wire loop from the culture. Then inoculate into this medium. Then we put again incubator 37 degrees. Then next day we saw lactose fermenting colonies with the gas production, acidic slant, acidic butt. In the acidic nature, that is following fermentation of lactose. This is the control one, no color. It turned into yellow. And also it is E. coli is a gas producer, but it's not producing H2S, hydrogen sulfide.